Brendan, what's up?
Kaz, what's up, brother? How long has it
How's
been? 2 years?
like 1 year?
It's been a while. Yeah,
Yeah,
1 year. One and a half.
that's
It's
crazy.
been
I thought
over
it
a
was
year,
longer
right?
too.
It's been over a year, I think, right?
Oh yeah, a little more. I think it was last winter when we talked.
Last winter.
I
Wow.
yeah, yeah, I know I gained a little weight, so trying to
Did
shed
you?
that off before I start. Yeah, I gained a ton. It was my
Well,
most stressful year that year. Uh,
what kind of weight was it?
so
Was it muscle weight? What are we talking?
we're talking a little both. We're talking a little both. But now I'm trying to shed it off. I'm trying to get 70 pounds down by the summer. So, I
70.
mean, yeah, yeah. I mean, so we'll see. Well, hopefully that works. But how's
Oh,
everything been with you? How's everything
well,
going
wait a
on?
minute. First, congratulations. You were accepted in dental school.
Yes, I was. Thank you, thank you. I appreciate that. It was an interesting process. I look forward to talking about it and everything like
Yeah.
that. So, but
Yeah. Oh,
yeah,
we're going to get into it.
how's everything going on with you though? How's everything? I've been keeping
Good.
up with your social media, watch some of your videos. It looks like life's been good.
Thanks, man. Yeah, I gotta pick it up a little bit. I mean, I just finished the boards. I guess that's 2 weeks ago now, so I don't find out for another 2 to 4, and
Mm,
then yeah. So now it's like, hopefully I passed. We'll see. But like now, real life begins. Just working, just content, mentoring, connecting with other people in the network, and
okay.
yeah, yeah.
This is just like the board certification thing is what are the specific perks for that you get? Like, do you get salary increase or anything like that that comes with it, or is it just kind of like a board certified type of thing? Like, what is the take on that?
Great question. That's exactly it. It's literally just you're board certified. It's but they run you through a bunch of scenarios. They want to make sure you're not going to kill anyone. You're doing safe
Yeah.
surgery. You understand the whole broad scope of the specialty itself, from like the fibula to the bone graft, like to pathology, diagnoses, what to do for things like odontogenic myxoma. Just and you know what, like and know how to do sedation medications so that you don't kill
Mm,
someone. It's so important. And so I believe in it. That's why I did it. I don't need it to work. If I fail, I can still work. There's no issues. You don't get
amazing.
more money or less. You don't get different reimbursements for insurance. You don't get like discounts on your malpractice, which I think you really should, but
Yeah.
you don't get any of that.
Interesting.
So yeah, great question. Honest truth is no literal like on paper, there's no benefits. You just have that board certification behind your name. Yeah.
Wow. Well, that's still cool, I guess. It's nice now you can put it in your, you know, nice little
Yeah, I
flex, as
mean,
people say.
yeah, I'm not about flexing though. I mean, and you probably know me by now. I'm not about
Yeah.
flexing. I'm more
No,
about
for sure.
like
For sure.
what do they? The analogy I was telling my fiance about is like content over cover.
Mm,
Just not about like social media content, but this is important for you. Always think about the cover of the. You know how they say like you got to read the book, don't just look at the cover. Like headline
yeah.
readers. I'm really big, and I try to tell people like think about the content of your book, not just the cover, like not just
Mm,
the car you drive, the watch you wear, the clothes you put on. You know what I mean? So
yeah. So what was the motivation to get a board certification then?
because I wanted to prove myself that I it levels the playing field with. So I'm
Mm,
a 4 year guy. I get all the
yeah.
time online. You don't have your MD. Are you even really bored? Are you a true surgeon? Are you this
I
kind
see. I
of
see. Okay,
levels
I see.
So that's really it. Number one is probably on social media. Like people, they can point fingers all they want, but now I've proved it that the playing field is level. Two,
I see.
I wanted to take this to like, let's see what this exam is like. I'm big on
Mm,
mentoring. Now I can give back if I pass. I wanted to see like, okay, what are these tough questions they're going to ask me? Can I do it? Did I learn this? So that's all.
that's cool. That's cool. It's like a self goal, a self accomplishment.
Looks like
Like
you're in your kitchen, man.
yeah. So me and my girlfriend moved into a spot, and this is the only desk space for a computer here. So yeah,
Congrats.
it's the kitchen. Yeah, thank you. I appreciate it. Yeah. So we're gonna be living together until we both go to graduate school. So just taking in all the time together before we separate physically.
Physically.
Yeah,
All right.
physically.
All
Yeah.
right.
So
What do you mean separate physically? What grad school is she going to?
she's still applying. She's in the application process right now, so still
Mhm.
looking. So she's not sure yet. I don't think she wants to be in the region that I'm going to be in though. So, but
Is
that's
she
all
uh,
good.
is she going dental too?
Pre med. She's into medicine. Yeah,
Medicine.
yeah.
Very nice. And just so listeners and everything, let's remind them where did you get accepted? Where did you commit to next year?
Okay, so basically, when we last spoke, we spoke a little bit about the process. I was a junior year going into my spring semester, And I like to do everything in phases. So I was really focusing on prereqs and just doing great in my classes. But I knew I was going to pick up on doing research for institutions and stuff like that. But we spoke a little bit about, High Point and working in school of dental medicine. I feel like there was a lot of unanswered questions about it. Even Dr. Eli, he does YouTube videos. He did a few Dana Lives with people from there. So, I really had this process of, I did a lot of research and I wanted to apply initially my first round of schools before I took the DAT to be schools that didn't require it. So that would be McGill University and Workman School of Dental Medicine, both that would allow me to practice within the US. So I sent my applications in for both institutions. That was prior to taking the DAT. If I got into one of those institutions or both, I would decide between those rather than taking the DAT. And I can go into the reasons for that a little bit more. But High Point contacted me first to come in for an interview, flew out to North Carolina. The campus was great, but the campus could be in somebody's basement. I really don't really care about physical location, what the campus is. I'm more about, the mission, the curriculum, the professors that are around. And, High Point really resonated with me and McGill. I like them a lot. So after my interview with High Point, I was accepted to Workman School of Dental Medicine. And, I asked them all the questions, the tough questions I had in the interview process about, what the school's about. It's a new school, the requirements, and like the endowment size I even asked about. And, at the end of the day, I liked it. I liked all the students that were there that were accepted, the very bright individuals. So, I withdraw my McGill application. I'm going to be going there.
Going to Workman.
Going to Workman.
North Carolina. And where are you right now? Oh, so going a little bit south. Do you know anyone down there?
No, not really, no.
Where have you grown up? Where are you born and raised?
So I was born in Harlem, New York, but I moved around a lot in my life when I was with my mother. But we settled down in Connecticut with my father in like 2014.
Gotcha. So you're
Yeah,
pretty close with Connecticut. Okay.
yeah, pretty much Connecticut, New York border, but like they're pretty much same area. Like
Yeah.
it's not too different. But yeah, that was pretty much it.
And then girlfriend is going to stay, you think, in Connecticut?
I think she wants to do like she's very I don't know I don't know just not south. She's
Not
not big
south?
on the
What?
south.
What do you
Just
mean?
not. She's just not big on it. She's not big on it. She's more like northeast, urban type areas. So, you know,
And you're
yeah.
going down south.
And I'm going down south. Like I said, it's if I really like the institution, I like what they're doing, and they take me, I'm going. And the price looks right, of course. So, yeah, pretty much.
Yeah, no problem. I mean, long distance is doable. And sometimes the
Yeah,
trainings, especially, you're going to be in school. The amount of studying that you're going to have to be doing if she goes the medical route, the amount of studying you're going to be doing is second to none. But these trains these days, I think that's the best form of transportation to
yeah,
study on. So you could go train long distances, study the entire time. Look, it's not ideal. It's not like you could, if it's far, you take a flight, no big deal.
yeah, yeah. And I also don't know if before I was pre-med and pre-dent, and I remember you were like, you got to choose one. And it kind of makes me cringe to think that I don't really like when people say medicine and dentistry. Like I do think dentistry is a subcategory of medicine. That is a personal belief of mine. Just it's a part of the body. It just makes sense to me. But I think dentistry definitely resonated with me more because same reason why I chose neuroscience over a biology major, just because it's more special. I like pre-specialized things. I think even if I was to go into like traditional medicine, I'd probably do a podiatry medical school first, just because I like that pre-specialized
Hmm.
going into it rather than doing all general and then specializing after, if that makes sense. I
Yeah,
don't know.
yeah, that makes sense.
Yeah, so but yeah, that was that journey. I'm willing to talk about it more, talk about working more, what I've learned. I know recent developments and stuff like that. So yeah.
Yeah, what do you want to go into next? Do you want to go into the pre-dental route? So you didn't end up taking the DAT?
So no, I took a few practice exams. I did all right on them, but
Mhm.
I think when it came down to me, it was just resources. When it came to paying the dental application, I have a lot of peers and people around me that spend thousands on traveling, and I've really just been. I haven't had a job outside of school, otherwise in the summer, but even now I was doing a lot of volunteer, a lot of other work and schooling during the summer. So it's like I really focused hard on my academics and not. I really just had enough money to get me gas from institution to institution when I was at Yale and Trinity. Finances and resources, I didn't have $6,000 to throw at applications, so that was a big limiting factor for me. And I just had to take that into account when applying. So yeah,
Absolutely. Yeah, and all the boards, like the DAT study courses, all the materials there. It's a pretty penny. That's a great
yeah.
point. Yeah, yeah.
I
But
mean,
you're
if you
right.
have the resources, do it. But I mean, I think yeah. So that's just that. But I know I would I do want to take the CBSE like in the summer of my first year. I've been trying to study for it now. I graduated early, so I have like 6 months.
Congrats.
So thank you, I appreciate that. Thank you. So I've been trying to study the Yankee cards a bit, and then I'm gonna buy U World soon once I feel good with that. Um, and I know that's gonna be expensive, but at least I feel like that money will be used to more. I don't know. I weigh that way heavier. I weigh that way heavier, in my opinion. I don't know, but
Yeah,
yeah,
and you'll probably get some money, some loans or something for school, right?
yes, yes. Actually, there's this new. Uh, there's this not really new, but are you familiar with Juno?
Juno, yeah, yeah, yeah.
Yeah, so I mean, I think they're a great organization. They're like, everything going on with the big beautiful bill and everything like that, with the new financial changes. Juno is like, I think a great resource for undergraduate. I mean, not undergraduate, people going into medical school, any graduate school. The whole idea of, I had a long talk with one of their people, like the whole idea of, bringing in students. They basically talk to all these different lenders, say, listen, we have 5,000 students. The more students you have, the better, but they have like 5,000 students. The lenders are like, they give you they lower the interest rate just due to the fact that they're bringing so many students. And, they want all those students, right? And they're bringing it to the
Ooh,
lenders. I mean, that's how they explained it.
yeah.
But, and
Buying in bulk.
yeah. And the
Comfortable.
Juno gets paid they're paying Juno to bring all these people.
Hmm.
So I think last year they had the interest rate down to 6%, and the federal loan interest rate is 9%. So, I mean, it's definitely something to look into, I think, for sure. So that's something I've been looking into. I think everyone else should too.
Those are big rates. Those are big rates. You're right. You're right. And excellent. Those are big percentages. But it's what's got to be done these days. I'm just
Yeah.
scared that some students taking on the debt can't like the cost versus benefits. What dentists are making these days. The TikTok video of the dentist making 1.4. Like you gotta understand, this is not typical. And
Yeah.
there are. It's funny because it's just. I mean, quick side note because we got to move a couple topics here before we. But it's so interesting because there's actually a contraction, a consolidation of the number of practices and dentists actually practicing out there.
Okay. Yeah.
But the dental schools, there have been several that have opened up in the last 5 or so years, or
Yeah.
5 to 7 years. So more practices have opened, but the number of jobs and offices are contracting because essentially, I mean, we could go into that, but that's what's going on right now, and that's a tough market. That's a tough market.
So do you think that
Yeah.
the fact that there's more institutions being open, I mean, I'm sure there's also dental schools being shut down, but not at the rate that there's some opening, like, is pushing out more dentists, and you think that could be potentially, do you think that would lower the wage for dentists in the future? Is that what you're kind of trying to say?
It already is.
Okay, so yeah, okay. Yeah, that was interesting. No. Yeah, no, it makes sense. It definitely makes sense.
Georgetown used to have a dental school, and that closed down in the early 2000s, maybe the 90s or so. There was a consolidation of dental schools going on between the 90s and 2000s. Okay, but the job market was, if I remember correctly, I don't have that many years in me yet, but it was still fine. It stayed steady.
Mm,
Now, since DSOs have taken up, they buy out, kind of like what we're talking about, buying in bulk. They buy all
yeah,
these practices and stuff, but then they look at the numbers and they consolidate. So they close this office, they sell that office off, they sell these bulk offices off to that organization based on the numbers, trying to
mm,
make profits. But they consolidate. They try to take 3 assistants, let's get it down to 2, so the overhead drops a little bit. That's what's going on in dentistry since like 2015s, and I could be off by 5 or so years.
yeah.
But the big picture is we're in a consolidation phase of jobs, the market, and everything in dentistry, but several dental schools have opened up, and none that I know of have closed because we have the pre-dent mentor app. If you look at that, Sean and I,
Oh
we
yeah,
created that. It's a
yeah,
free service. People looking, pre-dental students, dental students, even get some data, some real-time data, match numbers at the dental school into specialties. I'm working on that in the next couple of weeks for this year, but we got last year's for more than half the schools. Anyway, so there haven't been many dental schools that have closed since like the Georgetown, the
Northwestern.
Northwestern. There was
Yeah,
Robert Wood or something, that North New Jersey that kind of merged into what's now Rutgers. But there
yeah,
was like Newark and not Robert Wood. There was another one in North Jersey that I'm forgetting. There's like a guy's name. Nonetheless, it's very interesting what's going on. And I'm concerned that maybe these dental schools are manipulating the fact that loans are being given to students and then they
Mm,
could get that loan money. That's free money for them, right? They just take on students, they give more PowerPoints rather than actual clinical work,
mm,
working on patients, which is what you need to do to actually be a dentist.
yeah,
It's the trend I'm seeing in dental schools. So it's as long as you have a plan, everything will
yeah,
work out fine. But just be very aware of what's going on.
yeah. No, that's great. Yeah, thank you for that. Yeah, no, for sure. I definitely have been keeping up with like the field. I'm part of a few newsletters and watching your podcast.
Oh,
So
thanks, man.
that's also been great. It's very raw. I know as a resident, you had a little bit of like restrictions. I remember we spoke about that a little bit, but I don't know how that's working out for you now. Also, what makes a DSO different from, let's say, a person who just owns multiple practices in that
Great
sense?
question. I'm in
Yeah,
that right now. I'm
great.
in there right now. I'm in the owner just bought three more practices and he's expanding. The difference is so DSOs are generally defined. There's so many different things, right? There's a DSO is backed by private equity. That's one, and they
Mm,
expand and they become so expand that corporate feel comes in, right? Where
yeah,
now the doctor isn't the owner or the boss of the office, right? They
yeah,
like to say, "Oh, you're going to become like it's a fake partner. No one's going to overpower where the money comes from in private equity, right? So they may give you equity. They may call you a partner in the organization somewhere. They're trying to trick you, and they are. They're tricking so many people. But essentially, it's you have less power, you have less autonomy, essentially, which is like making calling the shots, choosing what you want to do, what you don't want to do. And they may change your hours. They may tell you you need to cover another office now. You got to go drive another 15, 20 minutes to go cover this other office on this day or these days of the week. That's corporate, right? Where
yeah,
you lose a significant amount of autonomy and power and everything. The other thing is that money backing by private equity. Private equity, for the listeners who don't know, private equity investment banking, they're like kind of like banks, or they lend money in order to get that 2, 3, 15 times back that money that they lend, essentially, right?
yeah.
So they'll lend it to an organization. That organization buys so many more practices. They sell that off. The money comes back in, and then they have to pay back the lenders of that money to private equity. Just trying to give general concepts. That's not always 100% correct, but there you go. So you could own multiple practices, and you might not have private equity involved. Great, but the that's generally like by definitions different between private. You could have a private multi-practice organization, but you could have a DSO generally backed by private equity. Both are corporate.
Mm,
And that translates to patient care because less autonomy means less doing treatment plans and the surgery itself or the timing of the day according to how you want it, right? That's just
mm.
corporate. So then you have smaller mom and pop shop versus corporate. That's another equation comparison we could go into too. But
No, solid. Yeah, no, solid. I know. Yeah, I think one of the videos I sent you talks a little bit about a person who's
yeah,
interested in that. At some point, we can look that over. I think that's interesting. But yeah, no, I've definitely looked at a little bit into the like comparing and contrasting them definitely for sure. And people definitely sometimes feel like they need to go towards DSOs, especially for like loan forgiveness, kind of, or just. But I do hear it's like a little rush, and you're kind of seeing patients to fill like a quota almost, or rather than like having that like full experience that you can have if you work for like a private practice. That's what I hear, and it sounds accurate. I haven't been in the field yet to see that. I also need to do a little more research on it, but yeah, I don't know.
you have a great start. Cass, you're on a great start.
Thank
That's a
you.
good start to it. Okay, and you're doing the research. That's all you can ask for yourself. And you
Yeah,
got into
yeah,
school, so all the stars are aligning, man.
yeah. Thank you. I appreciate that. I'm
Yeah,
trying really.
yeah. So let me see all of these ones. UK crisis. What was this one about?
I
So
think the UK is just. I think what it's trying to say is that I don't know if it's still a stereotype, but that the
it
I
is.
know the fact it is okay. So the people in Britain basically have less quality oral care. That's not my stance, but that's the stereotype behind it, right? I know there's a lot of stereotypes out there that aren't as accurate, but some things that people say is that it's the fluoride concentration that they have in their water. It's not as prevalent as it is in the U.S. Also, there's different like restrictions and legalities regards to dentists in the UK rather than the US. I think underfunding for them is also a big thing that people talk about. So yeah, I was wondering if you knew anything about that and what your thoughts are on that.
Yeah, I mean, my fiance got her master's in London. She was there for 2 years, and she
Oh wow.
said they don't take care of their. So this is generalized. We're generalizing. I don't know enough about the laws and restrictions and stuff over in the UK. Fluoride in the water over there. Also, truth be told, like fluoride in the water or not, oral hygiene and good oral care, a good regimen of brushing your teeth, flossing, using fluoride in toothpaste does a really good job. So
Mm.
that's something I like because you got to brush your teeth. Like you got to brush your teeth. And she was saying that over there, she met a lot of people, and like it's just their oral care regimen, their oral care, their oral hygiene. It's just not as substantial. It's not as frequent. It's not as common, I guess. And
Mm.
yeah, the guy's teeth in the video are pretty bad.
Yeah.
So
Yeah, I saw the video. I didn't know if it was just like propaganda still. Like I said, I haven't surveyed everybody in the UK, but I was wondering like the legislation and like all that with regards to, because I don't really hear about a lot of people saying, "Oh, I'm from the US, but I
yeah,
went to the UK to do dentistry." I don't really hear people going elsewhere to do dentistry.
true.
Um,
Good point.
Not as much as medicine, at least. So, because I would think that it's a high demand, right? Like since it's a stereotype that so many people need it, like
Mm.
that dentists would be flying to go out there just because of all the patients they can see and all the implants they can do and all the, have offices out there. But doesn't seem like the case. I don't know. I gotta look into it more. So I don't know.
That's a really good thought. Yeah. I think it generally has to be like reimbursements and stuff and getting paid for the work that you do. I mean, over there, I don't think you need to go to college to do dentistry. I think it's just after high school, you do a 5 year dental school thing and then you
Yeah,
can practice. I think that's something there. But then like how much money you get reimbursed for stuff, I don't know. I don't know what's over there. I wish I did.
that's fair.
On the other side of the pond. You want to do another video? Let's take a look here. Let's take a look
Yeah,
here.
there was what's it called?
You're not
That
taking
guy. Yeah, he's
Yeah.
talking about
advantage
DSOs.
that DSOs and dental offices have for dental students. You tripping. You can learn about job opportunities through lunch and learns and private dinners. You can get flown out to different cities to learn about the culture of their DSOs. And the best part, you can get paid for making content. So if you are not tapped in, are tripping. If you are in
Great
this,
point. One thing is it's also like the military, right? With
Mm,
DSOs, you can get their DSOs have so much money because they're backed by private equity. They're dumping money at people to get them enticed, right? They're don't fall for the fool's gold. Remember, DSOs generally or corporate settings generally, they're going to try and trip you on the loan forgiveness, but that is serious. That's really important, right? Similar
yeah.
to the Army, actually, because the Army or Navy, being in the military will help you pay for things too. What you have to be careful is once you sign on with them, there's so much going on as far like what okay, they're going to pay you for content. What are they paying you for content? $100 a post? Like I
Yeah, I don't know.
it's I don't know, but getting flown out to go to events to get CE to learn about different things, getting meals paid for, that's serious. Like I can follow that, right? But I've never been big for like let me get paid for this post or something. No, I want to make raw, unfiltered, transparent content for people. You could read right through things. I'm not going to post my little fake scrubs on showing my booty in the mirror. No, that's not me. But like you look at things for what they are: cover versus content. What's
Yeah.
actually in the substance of the fruit versus the peel. The other thing is I would totally use if they're going to throw money at you for dinner. I'm going to buy a T-bone steak. I'm going to get one of the most expensive bottles of wine. I'm going to
That's
do that,
funny.
dude.
Yeah, no, that's fair. No, it's
But
fair.
that's what they're there for, right? They're
Yeah.
trying to butter you up. Well, you better add on a little more butter for me. And you better tell
Funny.
me how is your practice going to benefit me over a private or a non-DSO, right?
Yeah.
I would totally utilize them. However, getting tied up in DSO, you have to understand it's going to be a high floor. So your salary is going to be generally higher than when you start out, higher than maybe a private opportunity, a private practice, right?
Mm,
However, the ceiling is much lower. So how high of where you can go with the money you're going to make is lower than the ceiling you can make as a partner, as an owner, right? Because there's tax benefits in being an owner. By owning the practice, you can work things where you're the owner. You're going to make all the percentage. In a DSO, your percentage is going to be like say 30, 35%. In a private practice, I myself am at 40%, right?
mm.
As an owner, you're going to be at 50, 55%, man. That's going to way overpower long term that ceiling, that DSO. They're never going to get you over that 30 to 35%. They're never going to let you go over that 35. Some of them are 40. you're going to break 50 as an owner, as a partner. Okay. So that's just hands down. Similar to the military in the sense that things are paid for, but the military wants you to have service for that time. Right.
Yeah.
So if you do 4 years of dental school, they're going to want you in the service. ROTC, I don't know enough about it, but you need to pay it back in time with
Mm,
the service somehow, like 4
yeah.
years, right?
Yeah.
So that's something to keep in mind. But if you could get things paid for, great. I would just not fall for the traps. Another thing, just really quickly, I don't want to brush over this. The restrictive covenant. Okay, a DSO has all the money in the world. Therefore, they can invest all the money they need to trap you into that opportunity that they invested to lock you in for 1 or 2 years. A lot
Mm,
of people think, oh, I'm just going to start. I'm going to get my loans paid off the DSO for 1 to 5 years. Then I'm going to leave and buy my own practice. Remember, your restrictive covenant, which means you can't practice in a radius outside of that office or offices that you're in. I've heard of them up to 50 miles, 75 miles around there. Some of them even more if you're in very rural areas out in the middle of nowhere. You're out in the
yeah.
middle of Squirrels Crotch, Pennsylvania. They're going to keep you in Squirrels Crotch, Pennsylvania. So if you want to open up that private practice, you're going to have to go 100 miles away. Just round numbers, right? You
Interesting.
can't
Yeah.
practice in there. If you do try, they're gonna hit you with a big fat lawsuit, and you're not going to win with that lawsuit because they have all the lawyers in the world and they can afford it. Okay, I tried to say that really fast. I hope that.
No, that was a really great. Especially, I really like that last point. I did not know that. That's something fast food chains do. I know they also often fight about that because, proximity and things like that. That's a really interesting point, and it makes sense
Very
because,
important things.
like for example, I had a barber shop I went to. I had a bunch of barbers there. One barber left and opened the shop like literally a few miles away, and now he just bought all his customers there. Right. So I guess it's trying to prevent that, where
You
it's like
can't do
all the
that
patients.
in
Yeah,
dentistry.
that
You
makes sense.
cannot do that in dentistry. It's designed to. It's literally in favor of the DSOs. So, you know what I mean?
Interesting.
And they're so big. They have all the money, all the power, all the lawyers, and then they make those people go and make laws to help them win over the employees, the staff, the associates, or the doctors and dentists working for them. Okay.
Mm. Wow. Okay.
So
Yeah.
he's really advocating for the DSO, Jay Nas,
Yeah,
right?
no, he likes it. I mean, I've heard other people too who are
This doesn't
who've
seem to be
like
an
thought
ad.
about it.
It doesn't seem to be an ad. And look, when I was in dental school, I was utilizing all those opportunities too. At the ASDA events, they'd have like a happy hour thing. I'm going to that happy hour and I'm getting 2 beers at a time. I'm taking all the shots, like responsibly.
Yeah, of
But
course.
anyway, let's keep going.
I think I also want to talk about the specialties. I feel like whenever people talk about specialties, they always talk about the same ones. Like, unless I have just more that I'm wrong about. Everybody talks about orthodontists, oral maxillofacial surgery, prosthodontists, periodontists, but dental dental anesthesiologist is like something I've heard about more often, but I don't hear about the oral facial pain
Mm.
specialty a lot. That I'm actually quite interested in after looking through a little bit. So yeah, how do you feel about like that? That's a specialty, right? That's like a registered specialty you could do, right?
Yeah. Oh, yeah. Yeah. I think a lot of those positions are combined with teaching roles at institutions. Just
Mm,
from I have very limited knowledge and experience on these, but from who I've met who are in oral pain and oral facial pain and medicine, they're managing a lot of people with like, from what I know and who I've referred to, they have like trigeminal neuralgia. They have
mm,
myofascial pain disorder that can't be solved with other conservative measures or surgical measures. Potentially like TMJ pain that isn't a functional issue. So that's like the myofascial pain. It's not actually TMJ, a functional disorder. It's more of like a pain or musculature disorder. Yeah, trigeminal neuralgia is a big one. Things like that, like facial pain and stuff like that. But is insurance covering those? I don't know enough about it because I don't know how the money like gets transferred from patients to the practice.
mm,
Maybe if you're service, but very rarely are people paying out of pocket to see you. And sometimes it's a disorder that can't be solved, can't
mm,
be treated and managed, but not as many times that like trigeminal neuralgia, it might not ever go away.
mm,
So those jobs are tough. Generally, when jobs are tough like that, they end up being in an academic setting, potentially hospital setting, perhaps. So it's as long as you know what that career path may lead. Like as an
yeah.
oral surgeon, you can go the medical route, surgical route. You could work in a hospital. You could work in an academic institution. You could be private. You could be DSO. You could be corporate. There's literally endless avenues for oral surgery because you could go the medical route too. All the other specialties, I would say, kind of fall in the basket of like private practice, DSO, corporate, or institution, right?
Mm,
Pediatrics, sure, pediatrics could be in the hospital setting. Pediatrics, some general, and oral surgery. I think those might be the only ones in hospital settings. And
really?
then all the other ones are like either academia or like office settings.
So to do pediatric oral surgery, like, could you, like, do you have to get another like fellowship or something in order to, or could you just be like, I want to do pediatric, or do you need some training for that? I'm assuming you need training
I
for that.
meant like pediatric dentistry. I meant
Oh,
like,
okay, sorry. Okay,
but yeah, I mean, if you wanted to do oral surgery and then predominantly treat kids, yeah,
yeah.
you could be craniofacial and then just predominantly treat kids. Yeah, yeah, that would be a way. I don't know the job that you would end up with because I'm not familiar, but yeah, that's definitely a route.
I like one of your podcast episodes with, I think, Dr. Ryan Dippenbrock, I think, he's
Yeah,
a football, I think. I watch that I really like that a lot just because that's not really, like, he's doing rhinoplasties and things like that. And he doesn't have an MD, to my knowledge. Like, it's just DDS.
correct.
So I thought that was really interesting and cool, especially, I think he's in, where is he, like, Indiana? I was also wondering the regulations for that because I know it could be differ by state. I know when
Yeah,
it comes to like Botox as well, like some dentists in some states can inject Botox and some can't. So it's like I'm wondering if it's kind of like obviously not like the bar where like you have to retake a test, but like does he have like do you think he has like fluidity to move through states and practice the same way he's practicing now in Indiana?
it's going to be different. Yeah, no, you kind of answered your question there. A lot of where you can do things is determined by the laws and regulations, right? So that's one thing. And then politics of the hospital systems and medical groups that are in your area are also going to determine it. I know we mentioned on that podcast, he was saying he had some kickback, especially in the beginning. Of course, he's going to get
Yeah,
pushback. He's a dentist, now oral surgeon, non MD, doing facial cosmetic
yeah,
procedures. He's got all the training in the. I mean, he went the military route too to get a lot of
yeah.
stuff
I
done. The
heard. Yeah,
experience. Yeah, yeah. He's
really talented guy. Really sounds really awesome. You followed him. I was like, wow, this is pretty commendable work, honestly, in my opinion.
very
Um,
impressive. Yeah.
but yeah, no, I could definitely see that some people, actually, I was in a hospital like a few days ago, and I saw Doc Physician Hall of Fame, and they had DDS on there. So they had two DDS people on there. You know what?
There you
I
go.
know they're not legally physicians, right? But like, I don't know. I thought that was interesting. There's people on Instagram arguing about that all the time. So I think it's interesting.
A lot of arguments, and then I try and get in there not to argue, but just to give that information. And then there was a guy on the TikTok live 2 weeks ago or so, and they're like, "Yeah, I heard your take is really controversial." I'm like, "What did I ever say
Whoa.
that's controversial?" And they're like, "Yeah, you were saying like the 4 year versus 6 year," and I'm like, "Look, my take is just this is why I am biased and pick the 4 year, but
Yeah.
I don't compare the two. I just kind of." Well, maybe not compare. I don't shun one or the other. You know what I mean? I
Yeah.
just try and give an unbiased, unfiltered, like, and then when I say this is why I favored the 4 year, it's solely personal opinion. That's not controversial whatsoever. Anyway,
No, it's fair. It's fair. People are going to see what they want to see.
yeah,
But it
people
seems
want to
pretty
use
neutral when you
themselves.
talk about it.
Yeah, I give a biased opinion on why I picked the 4, but I try and give a pretty balanced take on like what you have to do for either. Anyway, I'm not worried. People like to pick inflammatory words these days with the political landscape, but
True. True.
dude, by the way, you're going to experience stuff like that in dental school and stuff. Just stay away as much as you can. It's regardless of what side anyone that's listening, remember, it's distracting you from your academics. It's distracting you from the workplace. It's designed to divide us and conquer us. We just got to remember we're in this together. You're in dental school
Yeah.
together with other people, and they're not going to think of it that way. Just you're a good kid. You keep a head on stroller
I
going forward.
appreciate that. Thank you. Thank you. Yeah, no, for sure. I try not to engage. I
Good.
actually ran a medical debate society. I had that at my school. I started at two institutions, so it was interesting. We just talked about like medical practices that we do and like having that discussion about certain practices and how we feel about them. And so it was quite interesting. I think I don't know. I
That's
thought it was
awesome.
quite useful. Yeah.
You should
So,
bring that back in dental school. You got to be careful. And everyone's got their panties a bunch in these dental schools these days. But
yeah.
fluoride in the water versus not. And
That's what I talked about.
people
That was one of
bring
the
it.
topics.
Yeah, yeah. Look, go into it. That's the best way to kind of talk out thoughts and stuff. Engage in good conversation. Yeah,
Yeah, no, we had a few times where I was like, we're not going to talk about that conversation, just because I feel like sometimes it's easy to go from there to politics sometimes. So I tried to just like steer away from like any like sort of political jabbing and just kind of stay on the practicing medicine itself or
Yeah.
dentistry itself. But yeah, no, I do want to start a club or a group where we like look at complex cases and stuff. The craniofacial group um, at the dental school. I've been really focusing on that. So I think it should be interesting. I think it should give
I
us
think you should
more
do it.
knowledge. Yeah, we meet once a week. Everybody brings a complex case, talk about it. What did the doctor find? What was the solution and things like that? Diagnosis and I think it'll help a lot. I don't know. It's something I've been keeping on the back burner for sure. So
Absolutely. I'll tell you what, if you want to do that, we can, I got to think this through. I would really like that to do like dental debates like that, forward in the order or not. Like just one
yeah,
example. But then we get like a couple topics. Maybe we do like, could do like one a month, get a bunch of people to just throw on and
yeah,
run
that
like
would be
a
great.
podcast too, record it. Dude, that would be
I would love
fire.
that. I would love that. Yeah, I would love that. Hopefully it stays neutral. I think it will. Everybody,
Oh
yeah, I
no,
think it
it's
will.
not staying neutral. People are going to get heated.
Not. I'm be like, whoop, turn my camera off. but, but yeah, no, it sounds like a great idea. I think it's definitely something I want to do. I want to bring it there. The plan was to expand it to multiple institutions. We're only at Yale and Trinity, so but we were planning to expand it. So
I'll tell you what. Actually, I really like this idea. And
yeah,
so in a dental school setting, sometimes politics of that sometimes either side can have like political rooting,
yeah,
and those politics can spread to the school, and then the school doesn't like it, right?
yeah,
This is what I would do for you. I would wager I would like to actually help you do this, and we could anonymize the names on the Zoom, and we could have think about this. We could literally have a debate where everyone just picks whatever side they believe in, right? Or the opposite. They can do whatever they want. Turn all the cameras off and change the names to like, I don't know, Obama, like whatever.
yeah.
Put that in the name, right? And then everyone's anonymous, and then just go at it. I don't know,
And
man.
then
It's
everyone knows that those students are dental students in a way. Okay, that means no, it
dental
makes
students,
sense.
dentists, like it could be
Yeah, but
anyone.
yeah, okay, okay, yeah, I like that. I think the only thing though, and the only thing I fear with just debate in
Hmm.
general, philosophically, I guess, is that I think people are very sometimes egotistical in a sense where, even though they might find out, it's kind of like if you're in a petty argument with someone, and then during
Hmm.
that argument, you realize that, they're kind of right. And but you just spent 7 minutes arguing with the person and you're realizing they're right. Now people feel less inclined to be like, I was wrong. It takes
Hmm.
big people to do that. And so when it comes to debate, like let's say someone's realizing, and I don't feel like I don't feel like they're going to come to agreement. I feel like that's the only fear that I had when I was running we didn't have that a lot, at least that I saw. But that's the only fear when I try to organize stuff like that. It's just just losing the integrity. I think that's a big thing for me.
I agree. I agree. The ego can sometimes get away. The ego's always going to be there, though, and it's not something we could kind of
Yeah,
compete with or eliminate. You just need to hope that other people sign on. If there's ego, they're going to be wrong in some way, shape, or form, right? If
yeah.
someone else can kind of bring them back down to earth, someone that more knows a topic better, more experienced, well read on a topic more. Yeah, yeah. I got time for one more. What do you want to do? What do you want to get into? I got 2 minutes.
2 minutes. Let me think. I feel like I had something else. Let me see. I had I think I had. You know what? I think that actually might be it for me.
Okay.
I was
One
just looking
other thing I
around.
wanted to touch on when I was
Yeah.
asking you about loans and the next thing going forward, you talked about maybe taking the CBSE before you start dental school. The one thing I would say, I get this question a lot.
No, after my first year, like
After
summer,
the first year. Okay.
like
I thought
summer,
you were
summer.
saying after D1 year, the summer after.
Yeah.
Good.
I'll have more than enough training at that point with the 6 month game that I've had since graduating early.
Okay. Excellent. That's what I wanted to make sure you were going to say. I thought you were going to say you're trying to take it right before you start. Dude,
Oh
these
no.
next 6 months that you have, 6 months right before you start,
Yeah, 6 months around that. I think.
enjoy it. Don't like this time, you're not going to get back. You're at the end. You graduated already, right?
Yeah.
You're done. Congrats, man. Enjoy
Thank you.
this time. Do whatever you can. Work 3 jobs. Travel. I know. Like, stay within your means. Always stay within your means. But when you start dental school, you're not going to have that time to do that. So if there's like am I going to stay in tonight or going to go do that thing? as long as it's safe and responsible, go do that thing. Go meet those people. Go hang out. When you start dental school, you're not going to have that luxury to do that. So soak it all up right now. That's what I would say. When you start, you're going to know exactly what I'm talking about.
All right. Yeah, cool. I love it. Thank you. Great advice. I appreciate that.
Man. And when you're ready, we'll do another podcast. So give it a year. You'll be in the middle of D1 year towards the end. We'll go on the podcast. We'll go and study strategies for the CB. Literally anything you want to talk about. I'm here to resource you.
Also, I'll contact you with the debate. Probably I'll start it my first semester. I'm gonna get on it like my first semester. You'll see a text from me regards to that if you still are interested at the time. So,
yeah. Just don't let it interfere with your studies. That's all.
Yeah, no, for sure. Yeah, no, for sure.
Sure.
Too expensive to interfere at this. anything is too expensive to interfere with this at this point. So, but yeah, all right, cool. Thank you. I appreciate the meeting today. I appreciate you finding time, and yeah.
All right, brother. Good stuff. Good to hear, man. Congrats again. One more time. You got this.
Thank you.
All right, brother. Take care. I'll talk to you soon.
All right, I'll talk to you soon. See ya.
All right. Good night.